I'm just going to teach a little bit about what depression is like. The normal course of depression is that without inflammation, a single episode tends to last about 6 months. That's important because, what we can do is decrease that to 1 month with treatment or prevent it from happening again, from being on treatment with antidepressants. But that if you get put on an antidepressant, you have to stay on it for at least 6 months, because we know that because the natural course is 6 months, what we're doing with this, it's not like the antidepressants are acting like penicillin and killing off the bacteria that are causing the infection. In this case, it's more like taking medicine for hypertension or diabetes, which is that it is treating the condition to put it into remission, but it's still underneath, if you remove that treatment, just like if you stop taking your blood pressure medicine, your blood pressure will shoot up. And if you stop within 6 months, you will relapse back into the same depression, because it's just, in general, takes on average 6 months. Now, I will tell you from the research we've done, although not specifically in sarcoidosis, when there is inflammation going on, those tend to be the cases where people don't get better after 6 months. And if you don't intervene, the depression will continue on and on. This shows you that in people who have not been treated for their depression, you can actually measure that depression has a negative consequence on the brain, and there's shrinkage in what's called the hippocampus. The hippocampus is the part of the brain that is involved in storing memories, taking them from, what's called working memory and putting them somewhere into your brain to be stored for later. So that, for instance, with Alzheimer's has patients who have significant injury to their hippocampus. And this is important because it turns out that people with depression who aren't treated are at significant risks for getting dementia because of this kind of effect. It turns out depression is not just bad because it increases your risk of suicide and affects your function and quality of life, but it also is bad for the brain. You stop this shrinkage if you get treated. So that's important. And this is in a very important slide. This shows, so this is where the hippocampus is. It's this increasing sort of empty region here. These are the ventricles filled with fluid. And it's not that you're getting more fluid in your brain, it's that the region that surrounds or in the vicinity of where these ventricles are is where the hippocampus is. And as the hippocampus shrinks, there's nothing to fill that void anymore. So it's this progressive loss of brain tissue that happens. And what's even worse is that if you don't get treated and you just go through these repetitive cycles, over time, you get this chronic relapsing residual depression that is often less responsive and much more difficult to treat. So for all of these reasons, you want to get depression treated because, one, it's treatable, and two, not treating it isn't like just saying, well, I'll put it off and take care of it later, because later it's going to get worse if you don't attend to it.